There is a staffing crisis for people with developmental disabilities. It is a real crisis. People are not able to get their needs met.
In the following interviews, you will hear from self-advocates and others about how the staffing crisis in New York State affects them. We must all work together to affect change in New York State.
The support professional staffing crisis in New York State is having a profound impact on the lives of more than 100,000 people with disabilities. Michael Kennedy relies on support professionals every day.
They help me with my daily routine, such as, I get up, I do my shower. They help me with everything I do.
Michael spent years in state institutions, which were originally designed to help care for people with disabilities. In the end, many were places where no one should have been. The most infamous of them all was Willowbrook on Staten Island, where people were abused and left in filth. Robert F. Kennedy called it a snake pit. Michael got out of the last institution that he was in 1988. And that same year, he became a member of the steering committee, which helped to start the Self-Advocacy Association of New York State, or SANYS, which is an organization led by people with disabilities and works to raise awareness of civil rights and opportunities for people with disabilities. Robert Belden is another person who relies on support professionals.
If I didn't have my DSPs, I wouldn't be able to work. I wouldn't be able to get up, start my day, and I would be on SSI all my life. And that's not what I want for myself.
It's important to note that people who live in their own homes and apartments have unique staffing challenges. Many rely on staff through types of services which are commonly called self-directed services. Some of these staff are funded by the New York State Office of People with Developmental Disabilities to offer community habilitation services, which support a person with important tasks such as shopping, cooking, and other skills that are necessary to live on their own. Other staff are funded through the New York State Department of Health through their consumer-directed personal assistance and home health care programs. These staff assist people with their basic self-care needs. There is currently a significant shortage of staff in both of these areas, and it is affecting the quality of life of New Yorkers with developmental disabilities and threatening their ability to live in and contribute to their communities. We will now hear from two self-advocates about these challenges. BJ Stasio is a disability rights advocate from Western New York. BJ has testified at a New York State Senate committee hearing about the care crisis after having to sleep in his wheelchair for about 2 years because of a lack of support professional staff.
I was 2 years without the personal care, so I was sleeping in my chair, to be honest and frank with you, because I didn't have the support. There needs to be an awareness that direct care could be a career for somebody.
Real people around the state are being impacted by the lack of support staff each day. Another person who relies on assistance is Renee Christian. She has lived in a nursing home, group home, and now has her own apartment. Renee is concerned that if she goes into a nursing home, that she could lose custody of her daughter. Sometimes Renee only receives about 20% of the coverage she's entitled to. That's a real problem.
I have to sit here and I know that I have to go to the bathroom. And I know that nobody's coming, and I'm dreading it. And I'm holding it for hours, sometimes 10, 15 hours at a time, to the point where I'm not eating or drinking because I don't want to have to go to the bathroom. It just, how are you supposed to live like that and be healthy and thrive? I don't think that you can.
The importance of direct support professionals and other staff to people with developmental disabilities can't be overstated. They're really essential to them being able to live the lives that they wish to live, from being able to get up in the morning in some cases and even get out of bed to use the bathroom or shower, prepare for their days, whichever way they wish to spend it. be able to go to work if they have a job, in some cases to exercise their civil rights, like participate in a religious community, or even to be able to get out and vote in elections.
The reality is that without support professionals, many people with disabilities would end up in extremely restrictive care settings like nursing homes. That doesn't make sense for anyone. People with disabilities who need some assistance don't want to be in a nursing home, and taxpayers don't want to pay more in taxes than necessary. Pushing someone into a nursing home is the most expensive way to care for someone. Todd Varwerk is the Chief Policy Officer at Western New York Independent Living Incorporated. He also receives care services himself.
Everybody we keep in the community is saving Medicaid money in the long run downrange.
The solution to the challenge of attracting more people to assist people with disabilities is multifold. People need to be able to support themselves and their families to stay in a job and make it a career, and believe that there are advancement opportunities. In November of 2023, there was a rally at the state capitol in Albany to urge legislators to invest in the lives of people with intellectual and developmental disabilities and make it a priority to increase wages for the staff who support them.
A lot of them have a problem with the pay because they have to work as a DSP and then go do a second job so they can meet their bills.
People that are working in this profession can often make more money in other fields, so the turnover is very high, and people have to deal with having to constantly find another staff over and over and over again, which affects their quality of life.
And people in my situation are tired of people moving on to better paying jobs which require less skill and a lot less dedication.
Recruiting good DSPs, is a real challenge, and also keeping the good ones is also a challenge. We hate seeing ones that are, very good, and for them to have to leave to go to other jobs, or see them working two jobs just in order to feed their families, which is not right.
People like Michael Kennedy and David Liscombe have experienced being institutionalized and don't want to return. David has experienced the full range of what the support system has to offer. He has lived in an institution, then a group home, then in a supported environment, then independently. He now relies on some assistance from a direct support professional.
I've found it very rocky at times, and I've had to really make some adjustments. And the DSP has been there to help me do that. And without them, I don't think that would have been possible.
Ginny Burnham works with David full-time.
They do so much for the people they support in whatever they're helping them with. They are terribly important to all people that need them.
My name is BJ Stachio, co-vice president of the Self-Advocacy Association Board of Directors. I was present at a rally for direct support professionals today. I'm here to encourage all the advocates who are here and all of the advocates who are watching this to continue to speak up, tell your story, because it belongs to you. The only way change is going to happen if you tell your story. And to all the elected officials, please take time to listen, because our stories matter. That's what self-advocacy is all about. So continue to listen to the advocates that are your constituents who will come and visit you in your offices.